Our college at the University of Minnesota up in the Twin Cities is one of the more diverse colleges of our kind in the country. We have all of the full range of design disciplines: graphic, interactive design, product design, clothing, interior architecture, urban design, landscape architecture, and we're a block away from one of the major academic health centers in the country. And health has become a kind of dominant metaphor for understanding what we're doing and how it all relates to each other. And so what I wanted to talk about today is the work we're doing around this area, around the patient experience. As we look at other colleges around the country, design colleges working in the health space, there's a lot of really interesting one-off projects. But what we see lacking is a kind of holistic view about how all of these disciplines can help improve the quality of health delivery as well as the patient experience. And so one of the ways in which we think about this is to focus on the patient. So I thought I would take you through a kind of imaginary patient Z, let's call her, and look at what we're doing to both keep her out of the healthcare system, as well as to make sure that her experience in the system, as well as after emerging from it, is as high a quality and as good an experience as possible. And but let me start with the notion that we're, and I'm sure everyone in this room is very committed to, is the idea of keeping people healthy, keeping them out of the system. And of course, as we know, there are a lot of aspects of the built environment that we've created, the designed environment, the food environment, that is relatively toxic to people's health. For example, some 17% of all deaths are the result of related to poor diet and physical inactivity. In fact, the design community recognizes that we've been part of the problem. We've helped create this auto-centric, sedentary lifestyle, the food deserts, the tobacco use, all of the kinds of things that we know have negative health impacts have in part been promoted through design, through advertising, marketing, through urban design, and what have you. And so we feel as a group of designers that we have to take responsibility for changing that. So, for example, we have centers such as our Metropolitan Design Center, which is, and as well as our Center for Changing Landscapes, which do a lot of work in this region, the Upper Midwest, on creating more walkable communities, more mixed-use neighborhoods, basically nudging people to have more physical activity, as well as to have a stronger social network. We see the human ecosystem of the body related to the social, economic, and environmental ecosystems in which we all live. These are nested ecosystems, and we believe that we will never solve, for example, the human obesity problem without looking at all of the other ecosystems that are, in fact, nudging people to have bad diets and to not have enough physical activity. And so a lot of this work has been to really focus on using design to help people recreate rather than vegetate, easier to buy quality food rather than junk food, easier to walk rather than drive. But let's say that despite all of our best efforts, that our patient Z does become injured or ill and has to enter the healthcare system. How can we make sure that that experience is, as I said, as high a quality experience as possible? We have, and here are some of the statistics, the things that we keep in mind as we do this work. And we do believe that the biggest design problem of all is essentially redesigning the healthcare system itself. I think many of us in this room recognize that the system is not operating the way it should and could, and that this is probably the biggest design problem we all have, and one that we are eager to engage in. But so let's follow our patient Z through the system. So she and her family first interact in a healthcare setting, in a hospital, in the so-called front-of-the-house environments. And architecture professor in our college, Bill Conway, has been doing a lot of research globally, looking at what healthcare settings are doing in areas that rarely get studied. The lobbies, the gift shops, the food venues, the patient waiting areas, the family waiting areas and grieving areas. All of this space in hospitals and health clinics that really have a lasting impression on the experience and affect people's views of what's happening. And one of the things his research has shown is that relatively small investments in the physical environment, views outdoors, daylight, softer lighting, comfortable seating, can make a huge difference in the reactions and experiences of the people engaged in these environments. Well, one of the other things we're quite well aware of is that for patient Z, once she enters the system, she enters this environment that is full of disorienting hallways, fluorescently lit rooms, lots of beeping technology. These are environments that are not very welcoming. And so one of the things we've put in place is according to the manufacturer, is the largest wireless virtual reality environment in the world in the center of our college, which we are using to show how we can improve healthcare settings by enabling people to put on a set of goggles and walk through any environment in a health setting that we can imagine or create before it's built. And the power of this technology is that this isn't just something you're not looking at a screen, you are in this environment. And we find that it cognitively changes the way we perceive our surroundings, where once you're in the environment and walking around, it affects you emotionally as well as intellectually. So why don't we run this video, and what you're going to see is a little sort of image on the lower left, which is this person is walking around with goggles on. And this is a project we did with the Mayo Clinic, a rural clinic in Casson, Minnesota. And what you're seeing is what she is seeing in her glasses. So she is in that environment, walking around, total control in terms of what she wants to look at. And we see this tool as an incredibly powerful design tool for the health community to work with us to say, what does it feel like to be in a space, to go into an operating room and to say, no, this is too far away, I need something closer, I need something bigger, taller, we need more space here. We can immediately change based on that kind of feedback. And so I think that we see this as revolutionizing the interaction between the design community and the healthcare community by literally having us virtually work through all these environments before they're built to make sure that they are going to be the kind of experiences that we want people to have. This is an example of the goggles. This is very much in the kind of beta testing stage, so the goggles are kind of funny. You look a little bit like a robot with little blinking lights on top. So we still have to do some design work on the appearance, but we do believe that this will be a technology that will be widely utilized. And in fact, there's one health system right now that is requiring all of their design teams to use this facility as part of the design process of their facilities, so that the client, the health personnel, the hospital administrators want to be able to walk through their facilities and make sure it's what they want to get before it is built using this technology. One of the other trends in our field, which I know is also an issue in medicine, is the notion of evidence-based activity. And we are big believers in evidence-based design. In fact, we have set up one of the largest research databases of research related to design and human health. It's called Informed Design. And this has been something that two of our interior design faculty, Denise Guerin and Karen Martin, have developed. And so we also feel that empowering designers to understand the current research that is going on in all of the health journals related to the designed environment and design products is something that designers need to know. So, but let's also, one of the other things that we've been doing is we sort of follow this patient Z through this experience is beginning to recognize that they need break times. They also are going through a lot of emotional challenges in this process. And a landscape architecture professor, Rebecca Krinke, has been working on developing contemplative landscapes and spaces in health settings to reduce stress. And she's also been doing a lot of what's is called mapping joy and pain. As you can imagine, a hospital is a locus for both a lot of joy and a lot of pain. And one of the things we find is we have people map their feelings about places, that it helps them both articulate it as well as address it and deal with it and find comfort in the fact that the feelings that they've had in these places are shared by many other people. As well, her research has been looking at, so how does one reduce the pain associated with particular places? And this has fed into a lot of our interest in the patient experience and how we can recognize that there are certain places and certain times when there's a lot of pain going on, not just on the part of the patient, but on the families of patients. And we need to develop as many mechanisms as possible to reduce that. Another area we've been involved in is the redesign of hospital gowns, which have to be the most unpleasant, ugly bits of apparel that one can ever imagine. Two of our graduate students, Lindsay Gordon and Sylvia Gutman, just won a national competition to redesign the hospital gown that was funded by the Park Nicollet Foundation. You see it here. It's going to be going into production. And the goals, as we interviewed patients, was, obviously a gown that covers you up, that the patient has much better ability to control, and yet obviously still provides access for diagnostics and treatment on the part of medical personnel. And so, I mean, little things we found that, for example, people wanted a pocket where they could put their cell phone. So bringing design to something as simple and basic as this, we think can again have a transformative effect on a person's experience. We also have product designers like Barry Kurderwitz, who's been working with his colleagues at MIT. This is, for example, is a new endoscope. It's a new biopsy needle that actually can extract tissue in a less painful way, and has now been patented and is about to be put into production. I think one of the things that we are really grateful for being at the University of Minnesota is that we are one of the world's centers for medical devices, and we believe that the design community has a role to play in this as well. But what about the actual medical procedures of patient Z? Our Center for Design and Health has been working quite a bit in ORs and in health settings to actually reduce errors and improve processes. For example, some of the projects that we've done recently, we're in the process of redesigning the electronic medical records systems to actually follow the way in which healthcare personnel use these systems, as opposed to the way computer programmers think that we use them. We've been doing redesigning administration of heparin. We've been doing work in operating rooms on count processes to reduce unintentionally retained foreign objects in patients. We've been working in nursing stations, patient care units to minimize medication errors, and we've done a project on blood administration to ensure that patients receive the correct blood components. This work, we believe, is also at the kind of leading edge of the way in which designers need to be interacting with the health community. Not just redesigning gowns or redesigning hospitals, but actually engaged in the processes and procedures, looking at how errors get made, and looking for simple solutions to those errors. Some of the ROIs on this are amazing. I mean, there have been projects we've done where it's had 150 to 1 return on investment. There was one project that was literally a $20,000 project that we did that has saved one health system many millions of dollars annually in greatly reduced errors. And so I think that this interest and attention to process is, we think, also something where design can bring real value. We've also been working in the kind of post-operative world. We have a wearable product design center where, for example, we've been developing body scanning techniques to develop custom clothing and accessories for post-operative mastectomy and amputee patients. This is Karen Labatt, one of the professors leading this effort. We also have been taking some of the work we've been doing with NASA and bringing it into the health space, where Professor Lucy Dunn and her grad students have been developing smart clothing that has medical technology embedded in it. And so we see a future in which our clothing will be tracking our condition and enabling us to be more ambulatory than we might otherwise be, where we're actually not just sort of inserting pieces of technology into pockets, but we're actually developing monitoring devices that are threaded right into the fabric itself. And so the clothing is literally monitoring health, delivering medications, taking blood pressures, monitoring skin temperatures, and what have you. Again, we think that this can revolutionize the connection between design and health provision. So as we look across our college at the range of things that we're doing, we believe that the future of design and the future of health are intertwined. That health as a metaphor, as a kind of overarching interest, is something that guides us, whether it's human health, environmental health, economic health, community health, and that we believe that all of those scales of health are interrelated. And so that just as we have to look holistically at the patient's experience, we have to look holistically at what is the nature of the environments we're in and what is causing ill health. That ill health goes way beyond the body. It is actually the environments that we're creating, the food we're eating, the ways we're living, the air we're breathing, and that we as a health community as well as a design community need to look holistically at all of that. And that is something that our college is particularly committed to, with the goal of keeping patient Z out of the system and as healthy and as happy as possible. Let me just end by sort of asking the question of why do this? Now, obviously, I think we're all here because both the design community and the health community we do what we do because we want to improve people's lives. But there's a new book out. It's actually called God's Hotel, written by a physician, Victoria Sweet. God's Hotel, by the way, is a medieval term for hospitals, which I thought was interesting. And in it, she reminds us that hospital and hospitality have the same root word, hospice. And hospice meant the host treats the guest the way that host would want it to be treated when that host is a guest. In other words, this sort of reciprocity. And so I think one reason that we have really to focus on the experience of the patient is that it's not simply because it's our duty as health professionals or as designers interested in health, but because, as Sweet writes, in the hospital, every host will for sure become a guest. This idea of reciprocity. In other words, every doctor and, of course, every one of us in this room will ourselves one day be patients. And so we need to treat patients as we would want to be treated when we are patients ourselves. Thank you.